Hello and welcome to our channel. Today, we're diving into the world of pharmacy with a focus on the North American Pharmacist Licensure Examination, or NAPLEX. If you're gearing up to take the NAPLEX, you're likely aware it's a multifaceted exam that tests your pharmacy knowledge extensively. Today, we'll discuss a common type of problem you might face on the exam and how to effectively solve it. Imagine you're presented with a patient case that involves a prescription for hypertension management. The prescription reads lisinopril 10 milligrams orally once daily. The scenario provides further details. The patient is a 45-year-old male with a medical history of stage 2 hypertension, type 2 diabetes, and mild renal impairment. His current medications include metformin and atorvastatin. Now let's break this NAPLEX problem down. First, identify the key pieces of information. The patient's conditions and current medications are crucial. Lisinopril, an ACE inhibitor, is commonly prescribed for hypertension and can be beneficial for diabetic patients to protect renal function. Next, evaluate if the dosage prescribed is appropriate considering the patient's profile. For hypertension, starting doses of lisinopril generally range from 10 to 40 milligrams per day. Given renal impairment, lower doses might be preferable, so consulting dosing guidelines specific to renal function is essential. Additionally, consider drug interactions. Lisinopril may increase potassium levels, so checking potassium levels or advising dietary modifications is wise, especially since the patient is already on 2 other medications. Finally, determine follow-up needs. Discuss the importance of monitoring blood pressure and renal function periodically to assess the therapy's efficacy and safety. In summary, addressing this NAPLEX problem involves understanding the drug's role, evaluating correct dosing in light of the patient's conditions, and foreseeing possible interactions and monitoring needs. With a methodical approach, you can effectively tackle these complex case scenarios. That wraps up today's insight into a typical NAPLEX problem. We hope this breakdown helps in your preparation. Remember to like, subscribe, and hit the notification bell for more pharmacy-related content. Thanks for watching, and until next time, keep studying smart and stay motivated.